Hello, I'm Roseann O'Reilly Runte, President and CEO of the Canada Foundation for Innovation, and it is my distinct privilege to be speaking today with Timothy Caulfield, the Canada Research Chair in Health, Law, and Policy, a professor of law, a professor in the School of Public Health, and research director at the Health Law Institute at the University of Alberta. We are talking about the public representation of science and public health policy, the infodemic, the amount of misinformation that's out there, and the hope that we have for science and democracy and the future of the world. People have been reacting to bad science forever. What's different about today?
You're right. I always like to say, misinformation has been around probably as long as humans have been communicating, right? I always joke that scene at the beginning of 2001 or the apes are arguing about misinformation. So yeah, misinformation has been with us really forever. But what is different now, I think, is the volume. We've touched on that already. It's the volume and the modes of transportation. So by that, of course, I mean social media. Look, this isn't entirely a social media phenomenon, but it's largely a social media phenomenon. And we have a really good body of research that tells us that, that there's this growing body of evidence that tells us that the spread of misinformation, the polarization of public discourse, is being fueled by social media and the rapid dissemination of misinformation. And of course, one of the reasons that happens, it's a complex social phenomenon, no doubt, but that information plays to our cognitive biases, right? It plays to our availability bias. It plays to the confirmation bias and the echo chambers that we live in, and it helps to build the echo chambers that we live in, and it plays to our negativity bias. There was a fascinating study that came out, I'm going to say, 3-4 weeks ago, that found, that was exploring, why does misinformation travel so fast? What's different about it today? And what they found was that misinformation is more emotional, right? It's more emotional, it's more negative. It plays to our emotions and it plays to our morality. So there, I think, ideology is another way of thinking of that. And it's easier to process. You take those elements, emotional, negative, about morality, and being easier to process, and you have a recipe for the spread of misinformation, especially when you're talking about a communication environment like social media.
So what do you do when you have people who actually are really smart and they logically see that it isn't true, but they are emotionally attached to the answer? So, it's the battle between the head and the heart in a way. How do we overcome that?
Well, it really is. I think that's a good way to put it, because it becomes about personal identity, right? A lot of these misbeliefs, whether you're talking about something like, the anti-vax rhetoric or the embrace of ivermectin, the anti-parasitic, which became so popular with the anti-vax community. It's about ideology. These are beliefs that you adopt if you're a part of a particular community. So it's about in-group signaling. It is about, these ideological flags. If you could get in a time machine and go back 2 years and tell yourself that ivermectin, an anti-parasitic, was going to be an ideological flag, you wouldn't believe it. I mean, how would you even explain that? But that's where we are. And what we need to do, right, is figure out how we can break down those echo chambers and change people's minds within those communities. Now, there was a fascinating study. It's a hilarious study that, again, came out very, very recently, that what they did is they actually paid Fox News viewers to watch CNN. I mean, think how cynical that study is, because for sure everyone involved knew what was going on. The Fox News people are going, yeah, I know what you're doing. And the experimenters are going, yeah, well, we know what you do. But despite that, it still worked. Just exposing those Fox News new viewers to a different point of view changed their perceptions, changed their opinion on every metric. So it was quite successful. Now, of course, we can't pay people to watch it, but what it highlights, I think, is how important it is to develop creative ways for people to get different perspectives, to get out of their echo chamber. So that's one thing we need to do. The second thing we need to do is we need to get people within those communities, right, to engage these topics. And again, we have some research around anti-vax, right? If you get people within those ideological communities talking about the value of vaccines, you're more likely to change people's minds. So, that's also the kind of thing that we need to do. And the other thing, the other good news message, one that I always hammer away at, is that, countering misinformation does work. It may not feel like it works. It may feel futile, like you're screaming into the wind, but we have a pretty robust body of evidence that tells us if you create shareable content that goes to where the misinformation resides, you can make a difference. And more people are doing exactly that.
So maybe 20 years ago, Derek Kirchhoff at the McLuhan Center wrote a book called The Skin of Culture. And in it, he said, oh, it is so great. We're going to have the internet develop, and poor, isolated people will get together and find that community that they need to be positive citizens. Like in Bob Putnam's book, Bowling Alone, that when people do things together, they actually, they communicate together, and then they vote together, and they participate in government and so on. So he saw it as uniting these little groups around the world. But now, is it that we have bigger groups that are united through the internet? Are they, are the isolated people coming out of the woodwork because of it? What is the effect of this internet communication on it? Are there small communities with big voices, or are they actually massive communities around the world that we just don't know how many they really are? We just see Twitter responses.
Well, first of all, I think it's really important to recognize the value of social media and the value of our internet culture. I battle misinformation, so people assume that I hate it. It does bring people together. It does create communities. If you're an isolated individual, you're searching for a community of individuals who have the same values as you do, it can be a very powerful and constructive force. But those same forces, right, can build these communities that are not so constructive. And I think that's exactly what we're seeing happen. And it allows very loud voices to have an incredible amount of power. Now, look, this study I'm about to reference has been, critiqued as not being, totally methodologically robust. But I think the spirit of the study is correct. And what they did is they found, they call it the disinformation dozen, where just a handful of individuals shaped public discourse around vaccination, around, basically pushing an anti-vax agenda. And social media and the internet culture allows that to happen, right? In the past, it probably wouldn't have been as easy, because you have most of our communication controlled by a relatively finite number of outlets. And of course, that's not the case anymore. And the original vision, as you highlight, of the internet was very utopian, right? This was going to sort of flatten the access and allow democracies to thrive. And what we've seen, unfortunately, is by and large, not totally, but by and large, the exact opposite, because social media has become an engine of polarization, right? An engine of polarization, an engine of misinformation, because it plays to these cognitive biases, our preconceived notions, and builds, I think, often communities of hate.
So what should we do about that?
I've already touched on one of the things we need to do, and that is counter misinformation. We need to recognize, look, social media is not going away. We can rail against it all we want. The internet's not going away. We've got to figure out how to make content that is going to make a difference. We got to go to where the misinformation resides. Social media, for example, make shareable content that can make a difference. And there is empirical evidence that tells us that does work, right? If you go to where the misinformation resides, you make shareable content that's meaningful, it will make a difference. We have some very preliminary data that talks about how TikTok videos, for example, that counter misinformation are just as popular or maybe even more popular than the original source, right? So you can use the spread of misinformation as a pop culture moment to talk about what the science actually says, right? So we got to counter misinformation. We also, of course, need to teach critical thinking skills, media literacy. Again, glass half full guy. There's good empirical evidence that tells us that works too. You teach critical thinking skills, it can make a difference. There's a great study from Uganda that found where they taught 11-year-olds critical thinking skills in the context of health. They were able to learn those skills, apply those skills. So that's good news. There was a very recent study that talked about older adults, same result. We can make a difference teaching critical thinking skills. Yes, the regulators need to do more. So Health Canada, the United States, FTC, FDA. Yes, absolutely, the social media platforms need to do more. They need to figure out evidence-based strategies to stop the spread of misinformation. Even you, Elon Musk. And then we also, of course, I think, need to go after those individuals that are spreading misinformation when there are regulatory levers that we can pull. So the colleges of physicians and surgeons, when it's physicians, licensing boards in the United States, we need to come at this problem from every direction.
In some states in the United States, they want to control the curriculum in schools so that certain things aren't taught, even in a neutral way. And that's a way of ensuring that only certain information gets out. What is the role of schools and education in actually supporting a democratic participative society?
Well, you can probably guess what I'm going to say. It's so important to teach critical thinking skills in the school. And what's fascinating for me is those who make the arguments that you just put forward. The lack of conceptual consistency is mind-numbing. The mental gymnastics required, because it's often the exact same community that's saying they're being silenced when they want to spread misinformation about COVID or anti-vax rhetoric. We're being silenced. That's cancel culture. Our freedom of expression is being infringed. And that exact same community wants to control the teaching of critical race theory in schools, for example. It's the mental gymnastics is mind-boggling to me. But what we do need to do, and again, good research to back this up, is teach critical thinking skills that allow people to be able to cut through the noise. And there are some jurisdictions, Scandinavian countries, that do this very, very early, as early as kindergarten. And look, this is not, as I'm sure the critics will say, ideologically motivated. This is teaching neutral thinking skills that can be deployed throughout a lifetime. And I think that is becoming so essential in our current information environment.
So this is your opportunity to kind of try and help me summarize this whole thing. Where are we with misinformation and saving democracy?
Look, misinformation is killing people. It is killing people. This is, and I think it's having an incredibly adverse impact on public discourse and our democracies. Very recently, the new head of the FDA went so far as to say that misinformation, this sounds like hyperbole, but he meant it. Misinformation is eroding the life expectancy in the United States, having a measurable impact on the life expectancy in the United States. So look, misinformation is doing incredible harm. And it's largely because of social media and our new information environment. But there is good news. The good news is we're learning more and more about it. We're having more and more research about what is effective. And we're seeing more and more voices, really incredible voices, smart young people and people from a range of communities speaking up and creating content that's making a difference.
This is so interesting. We could go on forever. And this is Timothy Caulfield, Canadian Research Chair in Health, Law, and Policy. And the Canada Foundation for Innovation is very grateful to you for having taken some time, much more than a few nanoseconds, a whole half hour at least, to talk to us about this really important subject. So thank you very, very much.
Well, thank you very much for this wonderful opportunity. And I'll end with my two favorite words: go science.
Oh, my God, great. Thank you very, very much.